Hi, Dr. Kevin Windisch from Sparks Pediatric and Adolescent Medicine. Welcome to our video series for parents. Today what we want to talk about is ringworm. What is it? What can you do about it? Do you need to worry about it? So the first thing we want to emphasize here is, again, the importance. What we talk about here is designed for educational purposes only. It is not to replace visits to your physician. Please, if you have questions, make an appointment to be seen. We're happy to see you same day here, 775-359-7111. We really can't help you over the internet or over the telephone. That's bad medical care. It's not safe. It's not ethical. And so we're happy to see you. So what is ringworm? Well, the most important and I think first thing to recognize, ringworm is not a worm. It is a skin infection, but it's not a worm. Okay, it's a skin infection from any of a number of common funguses, and it can be spread by close contact with somebody else with ringworm. Most of the time what it's really spread by is by touching something that has the fungus on it and then scratching your skin. Okay, ringworm is similar to athlete's foot. You can think of that as ringworm of the foot. As far as, what does it look like? Well, it's patches of miscolored skin. Lots of things cause patchy, miscolored skin. It's not so easy to tell. Ringworm can look a lot like eczema. I've seen eczema misdiagnosed as ringworm and ringworm misdiagnosed as eczema. So it's not so easy to keep those two straight. And a lot of times the only way to know for sure is to do a skin scraping and either do a culture or look under a microscope and see if you can see fungus. It's easy enough to do. Skin scrapings don't hurt. It takes 20 seconds to look under a microscope or a couple weeks under for a culture. As far as how we treat it with anti-fungal creams, and you can use any of a number of anti-fungal creams. Some are over the counter, some are not. In patients that are immune compromised, even if they're only mildly immune compromised, like my rheumatoid arthritis patients who might be on methotrexate, or my diabetic patients, we often have to use oral antifungal medications as well. Now, ringworm can get into the scalp. We need to be careful with ringworm in the scalp. That's called Tinea Capitus. And the reason we need to be careful is this. You can't just apply the topical medications to the scalp. They won't get down into the hair root, and so they won't treat the underlying problem. So those always have to be treated with oral antibiotics. And these are not antibiotics like amoxicillin or tetracycline or Zithromax, Z-Pax. These are antifungal antibiotics. So we're talking stuff like something known as greaseafulvin or grease peg, or iatroconazole, fluconazole, diflucan. And these antibiotics have some potential for side effects. These side effects are not usually severe, but they can cause some liver problems, some GI upset, stuff like that. So you need to be judicious in your use of those medications, and so we need to be absolutely certain of the disease process first before we prescribe medication. The fungus can be spread from pets, so you do need to be careful that pets aren't spreading it if you keep getting it back over and over again. Same thing with spouses or anybody you share a bed with is a source of spreading it back and forth. But in general, you don't get it just from playing with, a child won't get it from just playing with another kid. These things really don't spread from daycare. This is a big deal for my high school wrestler patients, because they're rolling around on sweaty, wet, gooey mats, and they do spread all kinds of things, ringworm being one of them. And it can be severe in their cases. So I hope this has shed a little bit of light on this issue for you and kind of helped to demystify it a little bit. If we can be of assistance here in my office, give us a call, 775-359-7111. We'll be happy to see you next time. Or we'll be happy to see you same day. In the meantime, we'll see you next time here.